Dr. Lanny Johnson,
Good morning.
thank you for being here with me. Allow me, please, to properly introduce you. It's quite a lengthy intro, but I promise I'll make it easy.
Okay.
You are a pioneering orthopedic surgeon and inventor, world-renowned orthopedic surgeon who revolutionized arthroscopy, holding over 50 U.S. patents for groundbreaking medical devices and techniques. Founder of modern arthroscopy, as a founding member of the Arthroscopy Association of North America and the International Society of the Knee, you've played a pivotal role in developing minimal invasive surgical techniques that transformed orthopedic medicine. Major contributions to sports medicine. You've served as an orthopedic consultant for top professional sports teams, including Chicago Bears, Detroit Tigers, St. Louis Cardinals, Pittsburgh Pirates, Atlanta Braves, Boston Celtics, New York Yankees. The list goes on, helping elite athletes recover and perform at their best. Entrepreneur and inventor, you've founded multiple successful medical companies, including Instrument Maker and Implant Ideas, of which later were acquired by Smith & Nephew, one of the world's leading medical technology companies. Prolific researcher and author, published hundreds of scientific papers and authored multiple books, contributing immensely to orthopedic education and advancing knowledge in cartilage repair, sports injury, and joint preservation. Medical Hall of Fame inductee, recognized for your lifelong contributions to medicine. You've received prestigious honors, including the Lifetime Achievement Award for the Michigan Orthopedic Society and the Jack Breslin Lifetime Achievement Award from the Michigan State University. You're a leader in infection prevention and treatment. Your research has led to groundbreaking patents on antimicrobial treatments, including the use of protocotuic acid, PCA, for infection control, wound healing, and even potential applications in treating COVID. Innovator in golf science. Beyond medicine, you hold numerous patents in golf technology, inventing cutting-edge putters and grips under Prescription Putting LLC, proving your expertise extends far beyond the operating room. Dr. Johnson, thank you for allowing me to read that. And it is my absolute pleasure to be here with you. Thank you for spending the time with me.
Okay, where do we go from there?
Where do we go from here? Well, you've been very busy and you continue to be very busy. You have a tremendous amount going on. I've been very lucky to have you in my life for approximately the last year. We're working on a number of fun projects together. It's my absolute honor to be in that role. I thought I'd start the conversation with you. Oftentimes I ideate my podcast session content around conversations I have professionally, sometimes personally. Something that happened not too long ago, and I wanted to get your take. I had a conversation with a group, healthcare, merger acquisition group. We had a number of Zoom meetings. They're based somewhere in the Midwest. And they asked me, Alex, how long is this project going to take? It's a 15-page website. Nothing serious, right, from an output perspective. Just beautiful design. And I told them, site like this, how long should it possibly take us? 4 to 6 weeks in the design phase, maybe a month or so in the development phase. I think that's a reasonable timeline for a 15-page informational website. And they didn't like that. They said, well, Alex, other groups we're talking to are telling us it's going to take 6 to 9 months in order to do the same scope of work. And I just said, hey, don't hold me responsible for their problems, right? I'm sorry, but that's, in my view, let's say, inflated timeline. I was not hired by this group because of that point. My argument was, and I'm going to use this word just because I'm in your presence here, I'm the surgeon in what I do. I'm the practitioner. I very much dislike organizational structure whereby we are setting a meeting in order to discuss when the next meeting is going to be. I don't want to be in that kind of position where we have endless, needless conversations over and over. I want to be tactical and I want to, let's say, go in and perform what I need to perform. So again, I'm in the presence of a world-renowned surgeon. What's your view on that point?
Well, it isn't how fast you do something, it's how well you do something. But often how fast you do it is an indication of how well you do it. So if I was in the situation that you explained, I would tell them that, well, I'll give you the same price, but it'll last longer, just whatever time you wanted to have last.
I love that.
I mean, it's kind of silly. That would help bring to their attention that you're confident you're going to give them the same product they would have waited longer for. And of course, most person in business would like, with their money spent, they'd like to get the result as early as they could. I guess Here's another thing is that when I see the tip of the iceberg in a personal relationship, I move away from it because there's a lot of ice under the water that I don't see that I might hit. So in those folks, I probably, in your situation, you couldn't satisfy them because they have in their mind how they want to get this done.
Yeah.
And I would thank them very much and move away from the tip of the iceberg.
Fantastic. And agreed. And you've once said to me in previous conversation that essentially the message is, if it's right, it's right. And if it's wrong, it's never going to be right. No matter what amount of explanation or changes or whatever edits to my conversation with them I would have tried to make, wouldn't have worked out. And you've educated me. If you would share this story, I would love it, that there's been many times in your life, in your experience, where at the time something didn't go as you had thought it would, right?
Sure.
And you thought it was a bad thing, but you'd said something like, Alex, then I lived long enough and had enough experience to know that in fact it was a wonderful thing.
Yeah, what I used to think that acceptance was positive and rejection was negative. And so like as a kid, with a girlfriend, if the girlfriend left you think, oh, that's so bad, I really liked her, et cetera, et cetera. Yeah. Actually, I've learned in many other situations that I lived long enough to see that the rejection was the nicest thing that could have happened to me.
I love that. And it was proven, right?
Oh,
yeah, proven
right.
to you.
But before I had enough experiences with rejection, that I would have never thought it was a positive thing. So I've learned to just say, oh, thank you very much. And here's the thing. You saw something that I didn't see in this relationship, business, or whatever it is, and you therefore rejected it. And I'm thankful for it because I didn't see what you were seeing. You saved both of us some grief.
I appreciate that. Because I feel as if when one is looking for a practitioner in web design, development, et cetera, as I have a specialty, one of the most important things, can I do the job and can I do it well? One of the ways that I can prove that is to say, look at my portfolio. I have a vast portfolio. I have dozens of examples on my website. I have hundreds of projects in this Figma tool that I design in. That should be a strong indicator of the level of the custom nature of the work I do. It's almost to the point of like, do you like the work? I'm not saying that your site should look like everything in my portfolio. Everything in my portfolio is different, right? That's another point too, is that early in my career, there are coaches that try to sell kind of, services to individuals that are starting out and take my course and we'll get you 10x to where you are now. And it often was just do websites for lawyers or just do websites for doctors or just do websites for whomever, like find a niche and go and run with it, right? And I never listened to that advice. I often say I'm industry agnostic, right? Now, yes, I understand that if I was to approach, let's say, a doctor and I was to be able to, let's say, speak the lingo a little bit better than someone that is industry agnostic as I can understand that might be a benefit to the doctor. But now I feel as if I bring a collective experience from a wide range of client engagements that I think that perspective is actually of great value to my clients rather than me solely doing one particular thing, one particular way. You have any opinion of that?
Yeah. If you made a very convincing argument, but if the other side doesn't understand that, you have to let it go.
Sure.
And I keep coming back to, I don't know where they're coming from. I don't know their experiences. I don't know what they're seeing in me that I'm not aware of. They didn't like it. I say, thank you very much.
Yep.
They saved both of us a problem.
That's true.
Of course, I hate to miss out on what I'd call an opportunity, but I don't want to get into something that's just impossible to resolve and goes on and on.
Oh, so, I have had a number of those in my career, and I think that it stems around not following my process that I know and continue to improve and iterate. And again, I'm a layman, of course, so forgive me when I make these statements, but I imagine in surgery there are very specific ways in which you are doing a task. You're doing a specific set of things.
Yes.
In a different and, of course, much less serious way, I'm also following a process that I know that if we do things in this way, we have the best chance of a positive outcome here. One of the things I love saying to my clients is, or with prospective clients before they hire me, is hire me because you believe, you have faith in my ability to finish the project and you believe in my process, but doing it my way, you have the least chance of a negative outcome. I really believe that. And the inverse of that is, if you're going to hire me, please don't dictate the process. Imagine, it's hysterical to say, but imagine me coming to you, you're going to perform a surgery on me, and I'm trying to tell you how to do the job. It's ludicrous, right? It's ludicrous.
Well, here's what comes to my mind is that in spite of everything that you know you're able to do, one of the biggest things and the problems in medicine is not meeting the patient's expectations. So, for instance, let's take a total knee replacement, which is a common operation now for people that have disabling knee pain. That 25% of the people don't like the outcome. The outcomes measurably are the same as everybody in the whole group. But 25% didn't like it because they had a different idea of what was going to happen.
Yeah.
So I think in some of the situations you're talking about, if the person has the idea that it's going to take 9 months, that you're not going to meet their expectations by telling them 6 weeks.
Yes, true.
And so you have to, the biggest thing in medicine right now, even for malpractice suits, doctors get sued because the patient's expectations were not met. So now you see in any kind of thing the patient has to sign, there's a lot of disclaimers about what's not going to happen.
Sure.
So I remember I used to say to patients who were more in the athletic area, they might have been a middle-aged man who wanted to keep playing tennis. They said, well, how do you think I'll be? Do you think I'll be normal? I said, well, number one, you'll be an hour older after the surgery. That helped to get them a perspective of what was going to happen. They were not going to be reversed to youth, and we were going to try to meet their expectations if whatever they were, and they almost always had to be less than what they had in mind. So I think when you're talking about these people that refused having you do the job, they had an expectation based on what they've been told before, their experiences. And interesting, you weren't meeting it. If you told them it took 2 years,
maybe they would have been happy.
Yeah, right.
He must have been doing a really thorough job.
Look how much time he's spending on our project.
I love that.
Yeah, so you have to have in your mind more nowadays about patients' expectations.
Yeah.
And most people want something yesterday, not tomorrow.
Yeah.
That's how quick they want it. And so you had a different personality you're dealing with. I personally would have been so thankful to run from that situation because I would tell a lot of people, I would tell them, I can't meet your expectations.
Yeah.
Because I knew I could tell them, I know how to get a good result. And your expectations aren't going to match that.
Yeah. I love that. I love that. And maybe the question would have been not responding right away and said, well, what timeline would you like me to meet?
Yes,
right?
Yeah.
What would you like? And they say 6 to 9 months. I would say we can build 6 websites in that time, but maybe I should have just said, no problem. That sounds great.
No, we know we can do that.
Yeah, sounds fantastic.
Right. Call me 6 weeks ahead of time. So when you want that.
Correct. Call me 4 months from now. We'll start the process. It'll be great.
Yeah.
I understand. At this point in my career, I'm confident enough and I know what I'm good at and I know what I'm not good at. I know what I should take on. I know what I shouldn't take on. And there's I don't know if the word is confidence or comfort in just, this is who I am. If it works, if it meets your expectations and needs, fantastic. I will do everything in my power to ensure a successful result. I'm one with poor work-life balance, and I'm not one that can have a, let's say, issue with a client and then not allow it to, let's say, infect my personal life as well. So I'll do everything in my power to I take these things seriously, right? These are in many ways, the digital space of a client of mine, and who knows, it's immeasurable, the value of that for their business. I take it very seriously. So I hope you
I think you're saying, I hope it's my intent to meet your expectations. That's basically what you're saying.
100%. My intent to meet your expectations and to do whatever is necessary to ensure that is the case.
Mm-hmm.
Is the case. You look, there's so many possible things to discuss with you. I could take endless amount of your time, which I won't do. I'd love to just go down the road and talk about protocateoic acid, PCA. Correct me if I'm wrong. 2 decades of your professional time, energy, love, experience dedicated to this. Why this amongst all the accolades, all the things you've done in your life? Why PCA?
Well, it actually started before 20 years ago. Because of being an orthopedic surgeon interested in bone and joint injuries or diseases, I had an interest in how cartilage might heal. You'd have to understand, if you went back 40 years ago, the literature by all the famous doctors said that cartilage will not heal. And that was a good argument because it didn't have a blood supply. Almost other tissue like skin, muscle, tendons, heart, liver all have a blood supply. Cartilage uniquely doesn't have a blood supply. And so you would say, oh, it can't heal. Well, what's happened and what we've learned over time, especially because of arthroscopy, the chance to look inside of a person's knee joint through a small scope without violating them much, you could see what happened at your surgery, and you could go back and look without hardly violating the patient and get a visual documentation of the healing. And we learned that cartilage healed. So I had an interest for long before 20 years ago in cartilage healing, and published on different things and different procedures that showed that cartilage could repair itself. And then I saw in a newspaper article in Lansing, Michigan, that some scientists at Michigan State had done a study where they showed if they put, ironically, the dyes of cherries that make cherries red on the islet cells of rodents, the pancreas cells, it made the hormone insulin. And so then I reasoned, I wonder if these same dyes put on other tissues would stimulate a growth hormone. Because we knew over the years that a growth hormone, human growth hormone, IGF-1, or insulin-stimulating hormone 1, would heal cartilage, but no one had ever seen it in humans. And so I then went to a laboratory in California, Scripps, and we took tissues from people's knees who were having surgery, with their permission, of course, and we put this dye on the lining of human joint, and it made the growth hormone. And therefore, we had a breakthrough that showed that these dyes applied topically to human tissue would have the potential to have healing of cartilage. And then I took it from there and did some animal experiments to verify that.
Wow. Okay. And in my view, and from what I've learned from you over the course of our relationship, is that the potential benefits of PCA are wide-ranging, tremendous. It's not just specifically for this topic. There are many things in which it can benefit. Can you speak more to like how you got to today and the product, which is joint health, and then how you then reason to see the other applications of PCA, which are tremendous? And I'm going to use the word unbelievable because I want to go in that direction and ask your opinion about that word.
Well, a few minutes ago, we talked about rejection and how important that was,
Yeah.
and how positive that could be.
Yeah.
So more than 14 years ago, I had this evidence in humans and in also animal studies that showed that this protocatechoic acid, or PCA, could cause the joint lining of animals or humans to produce a growth hormone to heal cartilage. And I proved that, and I applied for a U.S. patent. I couldn't get the patent. I argued with them. I even went to Washington, D.C. and met with the examiner, wanted to explain to her how wrong she was, how she was keeping humanity from this great, wonderful thing that I discovered. Negative, negative, negative. So I went like, oh my gosh, I wonder what else PCA does while I'm waiting for this patent.
Okay.
So I started reading about it. And one of the first things I read, which is really topical today, was I read that if chickens were given protocatechoic acid, a small amount in their feed, they didn't get avian flu. I thought, oh gosh, that must be really good. It must be good as an antibiotic also. So I then studied whether it could be possible as an antibiotic. And then I went through one independent contract lab after another, paying for these studies, and I proved that protocatechoic acid was a broad-spectrum antibiotic. The reason antibiotics don't work today is because they're not biofilm destroyers. So I did a study at an independent contract lab in Marietta, Georgia. I proved that PCA is a biofilm destroyer. So there's only been one new class of antibiotics in the last 50 years. I have the second class. This is all why, because I got rejected.
That rejection moved you and pushed you in order to take it a different direction.
Yeah.
And to learn more and more and more about its value.
Yeah. And so although I didn't like the rejection, and I argued with the examiner about it, But then, so over the last 14 years, not getting a positive result from my real interest in healing cartilage, I now have 31 U.S. patents on protocochoic acid. Why? Because of the rejection.
Wow.
Isn't that amazing?
It is amazing.
Now, I could have taken the rejection and just quit.
You certainly could have.
Yeah, and I'd say I could do something else. But, curiosity is really a wonderful motivator. I just wonder how this works. I wonder how it works that way. Wonder why it works that way. And so you just go from one unanswered question after another, and you can have a pretty exciting life of discovery, wondering how this works.
Wow. And tell me, please, the story of you ended up getting the patent that you wanted, and the wording of it was very significant.
Yeah, that's really interesting. You got to love rejection. That must be the topic we're on today.
I think that is, yeah.
Because what happened, I had evidence that this would affect osteoarthritis. Now, the reason that one's important is that there is no disease-modifying drug for osteoarthritis. All the drugs that we have today are ones that control inflammation but have no effect on repair of the cartilage. Okay. So I went through 3 different patent attorneys, a lot of money, 3 different examiners, and when the patent was finally given, the language to the claim was that protocochoic acid was good for the injury or disease of synovial joints. That meant every kind of arthritis, and I was only applying for osteoarthritis.
It's incredible.
That's a wonderful story.
It is a wonderful story.
So if there's nothing more encouraging to people that get rejection, they ought to go, hallelujah,
Wow.
I just got another one.
Yeah. Wow.
But it requires you being, persevering and not taking the rejection as the end of the story.
Having grit, having the strength of character to continue and see it through, and don't let one obstacle stop you.
Okay.
Yeah.
May I go to my present rejection?
Please.
Okay. I told you back that more than 4 or 5 years ago, I learned that protocochoic acid would control avian flu. Not because of my discovery. It's all in the literature. Okay. So what I did back then, actually it was back in during the time of COVID when I learned about it had an antiviral effect. So the first thing I did, I said, well, I need to do some studies in 2020. Does this control COVID? The answer was yes. And by the August of 2020, I had patents on how you could control COVID by the SARS virus. You could destroy the SARS virus.
And this was via spray, correct?
A spray, or it could be, could be a pill too.
I see.
Okay. Now, do you think anybody was interested?
I have a strong feeling that it's no.
Yeah, correct.
Yeah.
So why would people not be interested in a treatment for COVID?
Well, the money is in the caring for it, not in the solution, right?
Exactly. So if you could have a vaccine that you could give every year, it's a cash cow. Now, it doesn't, for instance, the flu vaccine is 40% effective, but it's mandatory to take. And government wants you to take that. And then the COVID vaccine was mandatory by the federal government. People lost jobs and, positions and everything. Now, here's what happened after it was no longer mandatory. 3% of the American population took it.
Wow.
Does that tell you how public opinion was of how good it was?
Certainly does.
But now let me get you back to my poultry story.
Okay.
It's just totally amazing to me. So I wrote up 4 years ago a long white paper on everything that was in the literature, not my work. I have no financial vested interest. You can't get a patent on it. I own nothing. And I contacted every major company that produced eggs and chickens. No interest.
Wow.
Okay. So I finally felt like I was defeated there. And so last fall I came back to Michigan for the summer, and the major egg producer in Michigan named Horrocks lost 4.5 million chickens. They had to destroy them.
Wow.
And I thought, oh, they got to be really interested. I'm only an hour or 2 from their place. I'll go see them and we'll solve this whole thing. 2 letters, FedExes, whatever. No response. I said, these people must have a fabulous insurance policy to lose 4.5 million chickens and not seem to care.
Yeah.
Well, here's what I subsequently learned. I learned that the government reimbursed them. That's the insurance company.
I see.
So when you lose 4.5 million chickens, which would be a huge loss for your business, that's covered. But then as a result, you can publicize that because of avian flu, we had to double the price of eggs.
Yeah.
And so what happened is that the industry had no losses and increased their profits by double.
Wow.
So I just was so discouraged. So then we have a new administration and we have a new head of agriculture in the United States. So I write the head of agriculture of FedEx, because I think they'll see a FedEx. And on outside the FedEx, I wrote avian flu, so they'd know what it was about. No response. Okay. So then I keep reading. This is the perseverance aspect. Okay. So I see that there's a woman scientist at Michigan State I came across, because the internet's so wonderful for researching things. And she's an expert in chicken feed. I thought, oh, this is my expert. Okay. So I contact her, but she was too busy in a week to read it, but she could get back in 2 weeks, because they had meetings, and they have committee meetings in the university. And so she finally got back to me. She was very polite, and she thought what I had was really interesting. But the way the conversation came down was, because this did not involve a grant that she could get, she didn't care if avian flu got treated.
Wow.
Because her job is to get grants for the university from the government, and the government wasn't giving that many grants now because the new administration, so she had no interest.
Yeah.
So 10 days ago, I decided I'm going to write the Wall Street Journal, because they did an article telling how the government's going to get rid of avian flu. They're going to reimburse the chicken losses. Is that beautiful?
Yeah.
Excuse me. They're going to reimburse the chicken losses and allow them to double the price of eggs. That's the solution.
That's the solution.
Yes,
yeah.
Right. Just exactly what they've been doing over and over again.
Yeah.
And so I haven't heard back, of course, from the Wall Street Journal, because they said they published a big article on what the government was going to solve this. And so they said you could write to an op-ed concerning a journal article, but then you can wait 3 weeks to see if they respond. And if they respond, then they might publish it. If they don't, you're free to do anything else you want. So then I was some other doctor friends the last 2 days of medical meeting, and they gave me some other ideas. So I haven't quit on this, but to me it's so ludicrous.
Yeah.
That that if you wouldn't have to spend $1,000 on all the chickens in America, because the amount that controls, according to literature, 2 papers.
Again, not by Dr. Lanny. These are established elsewhere.
Yeah,
yes,
right.
Yes.
I can read and write.
Yes.
I would think people in the government can read and write, but I'm not sure they can.
Yeah.
And so it's in the public. I even made clear to them, it was in the public domain and it's free.
Yes.
But maybe I didn't have all the mechanisms worked about how payment goes under the table and above the table. I don't know. But anyway, that's my most rejection story is in the poultry industry.
Yes, yes. But look, again, you continue to persevere it, and who knows what will come out of it, and who knows what direction it might take.
Well, I've got some important orthopedic things I'm doing. I just thought that
of course.
I was tracking down the rejection in the poultry industry, which I thought might be of interest to people, because the price of eggs is so huge throughout. Cake batter, everything you do requires eggs. Anyway.
Well, right now at Trader Joe, I can only buy 1 dozen a day. I can't buy more.
Oh, but what I like is we're going to employ what the other solution the government has. We're going to import them from Russia.
Oh, wow. I didn't hear that.
Oh, yeah.
Oh, wow.
So what you want to do is you want to go to China. The people are your biggest enemies, and see if they will help you solve the problem.
Yeah, wow.
It's totally crazy.
Defies logic.
What?
Defies logic.
No, well, that isn't even logic. You couldn't be that stupid. I mean,
you made this point before about you couldn't be this stupid. You've said that to me before. It's that. Do me a favor. Explain to me. You have I don't know what to call it. It's a way of thinking. It was 3 steps. One of them is it believable or unbelievable? Mm-hmm. Can you please explain to me this thinking of yours?
This was really helpful to me to have. Being a surgeon, and I like to be organized and categorize everything, and step by step. I like to work from known to unknown. I don't like to get into, I always take a known over an unknown, given 2 choices, a known over an unknown, because I don't like to get out into an area I don't know anything about. So it occurred to me that there are 3 categories that I like to look at an issue about. One, is this, first of all, it doesn't make sense, of course, but beyond that, I look, okay, is this scientific or not scientific? That's important to me. Does it have a scientific basis? But then you have to think, is that believable or not believable? Because it could be in the first category, it could be non-scientific, it could be believable, or it could be scientific and not believable. But the third category, which is important, is this true or false? So I like to think, is this scientific or not scientific? Is this believable or not believable? Or is this, what I really want to know, is this true? So something could be scientific, believable, and false. And we have many things in medicine. Well, here's a great story. There was a surgeon named Semmelweis back in the 1800s in Switzerland. And he saw they were having a lot of infections in women who were delivering babies because the doctors were going from the autopsy room barehanded.
Wow.
And going to deliver the baby. And lo and behold, the babies and the women were getting infected. So Semmelweis came up with the idea that maybe if we washed our hands between, we'd have less infection.
Wow.
And he proved that. And you know what they did for him? They sent him to a mental hospital because they thought his thinking was so screwy.
Wow.
And so Semmelweis is the great one who had something that was scientific, and it was unbelievable by the people looking at it.
Yeah.
But it happened to be true.
Wow.
So that even happens in medicine today. We have many things that I have a talk that I said that is said called things that we knew for sure. There are lots
like
of
that.
things we knew for sure.
Yeah.
There's so many. For instance, we knew for sure that cartilage didn't heal. Been proven that it does.
Although there's no blood supply.
Right, because it actually happens because there is bleeding in the joint, and the blood comes from not from the cartilage, from the joint lining, and attaches the cartilage and causes healing.
Interesting.
So it didn't have to come from the cartilage; it came to the cartilage. But so it's another case of being scientific but unbelievable but true. So those categories are helpful, and in issues of life, But basically, it comes down to, does this make sense?
Yes.
But what we want to know is, it's true? Is it proved over time? Do we have good evidence that it makes sense?
And correct me if I'm wrong, in your view, just because something is unbelievable, which frankly, it's arguable that protocatechuic acid is unbelievable.
Yeah, I think so.
You've dedicated a tremendous amount of your time, life, and you continue to pursue it, although you are met with so much resistance, right? So much resistance, as you've explained some of it, of which I'm sure there's much more. How do you look at that? I mean, I know that you're a spiritual man. I'm very interested in that subject, by the way. And I'm interested to hear from a spiritual perspective from you, if you would care to share with me your view on this, being something that is of tremendous import in your life, in your history, and what you're, what you have, everything, right? So if you would speak to the unbelievable, and you would speak to, your view on it from a spiritual perspective, if you don't mind, I would love that.
Sure. Okay, well, first of all, in most of our things in life, we go back on a past experience to see how we did. And then that influences our confidence that we might have in what we're working on today. So I have to go back to when I was involved in one of the pioneers of arthroscopy. This is the irony of that. The doctors in orthopedic surgery who were most against arthroscopy in that day were the sports medicine doctors of the day. Today, you wouldn't be a sports medicine doctor if you didn't do arthroscopy, because every newspaper tells every sports athlete gets arthroscopy and it's back, right away.
Of which you founded, and of which, tell us the story how you would go and give speeches, and people would essentially, other doctors who were older than you were essentially, correct me if I'm wrong, talking down on you.
Oh, no, against me.
Against you. And they had argued why opening the surgical field was somehow better than you going in this way. Can you tell the story, please?
Well, of course, I was younger then, and I respected them. But I have to also go to this, how I got into arthroscopy, because all of the sports medicine doctors of the day were 100% correct in their diagnosis. So when they thought that the injury was on the inner side of the knee, they opened an incision on the inner side, and they found exactly what they believed. That wasn't my experience. I thought I was halfway good, but I wrote a paper on 5,000 cases I did and how my judgment, what I thought before I opened it, was wrong. Not every time, but it was wrong. So how would you like to be right? Well, I'd like to look in the joint with a little telescope and see what's wrong, and then I could know, do I open inner or do I open outer? But those doctors were all 100% correct, and I wasn't. So I needed a crutch to be as good as all the experts. Okay, of course, what I found out, they were not telling the truth. So then I would go to meetings, and I would be telling how I thought it was good to look inside the joint, very minimal invasive, and be able to know what's wrong and how to dictate what you're going to do. And they would argue, well, doctor, how can you look through a keyhole? You can see better if you open the door. So they said, this is totally non-medical reasoning.
Okay.
So they would like to make a 8 to 10 inch incision to look in to see what's wrong, and I would make a 1/4 of an inch puncture wound to know what's wrong and how to dictate what we should do. But they would continue to argue that. So I can remember one at the University of Michigan, they had me down there to try to tear me apart. And I said, well, at the end, we got near the end of the discussion of their argument. I said, well, let's do it this way. Let's go out on the street and ask people which way they'd like to have this done. And that ended the conversation.
Yeah.
And then you have to know there was so much resistance that at the State of Michigan Orthopedic Society kept me out for 11 years. But then about 5 years ago, they gave me the Lifetime Achievement Award, asked me not to say anything about how they kept me out. The doctors in my town came to me and told me I was performing an immoral and unethical operation.
Wow. At the time when you wanted to do arthroscopy,
when I was doing it.
Yeah.
And if that was true, it's the most common immoral and unethical operation done today by orthopedic surgeons.
And I only know this because you've educated me, and not only for orthopedics, correct? This now has moved to other areas of surgery, correct?
Well, yes, actually, I think it was in the early 1980s, I told the doctors in my hospital, I thought we could do a gallbladder by the same method. And of course, they thought, you're crazy, Lanny, you're not going to do that. And then then I tried it I was visiting professor at USC in California, and we tried it on a dog, but a dog was wrong. It has to be a pig to do it. But then 2 years later, gallbladders by puncture wounds were then done. And of course, now we have Da Vinci operations and all kinds. So I think orthopedics really launched the minimal invasive surgery aspect because, now you can get an aortic valve replaced through your artery.
TAVR, I think it's called. Is that correct? I forgot the name of the procedure. Sorry, I think I know the name of the procedure that you were mentioning. Yeah, that you could do it through.
Oh, yeah.
Yeah, it's incredible.
Yeah, it is. So
incredible.
But here's the other thing too. Even though you're going to do an adventure, I consider it like any kind of financial investment. I want to know the downside safety. So I don't, and that's important in every surgery. It's just like a financial investment. What's the downside safety? I have to weigh the upside, the potential of the benefit I'm going to get against what are the potential complications.
You mean arthroscopy versus open, or you mean just doing the surgery at all?
Any procedure.
Any procedure. So whether to do it or not.
Yeah, any procedure. If I'm going to take a pill, like if you read on the internet now that the FDA approves these pills, and it's like there's one for cancer, you can live 2 months longer if you take this, but you want to make sure you don't convulse it, you don't have urinary problems, your liver doesn't shut down, you don't die of a coronary. I mean,
the list is horrific.
It's just totally crazy.
Yeah.
I hope that there's some sanity come to this, and if we can break the partnership between the FDA and Big Pharma, that would be a benefit. On
the subject of knowing when to do and not to do, looking at the risks, looking at the rewards, you have a fantastic story, of which I know. I'll use these words because you've used them yourself in conversation with me, that you were looked upon as a small country doctor.
Oh, yeah, right.
Versus was it New York, whatever?
Oh, yeah, the Ivory Tower.
Could you, you know where I'm going with this. Yeah. Could you please tell us the story?
Yeah, well, the first part of the story is that because before me, people thought that arthroscopy would only be good to make a diagnosis. But I invented some motorized instruments that made surgery possible.
Meaning to say that initially, just so I understand as a layman, you're using arthroscopy to diagnose the issue.
Yes.
But the actual operation was still done to open in order to fix the problem.
Correct.
And you resolved that issue by creating certain special surgical techniques of which the actual surgery could be performed through those same incisions. Is that right?
Because I invented the motorized instruments that removed and cut tissue at the same time.
Wow.
And but what's interesting that the people who was in arthroscopy early only had a vision for diagnosis. They had no vision for that there could be, surgery could be possible. And I could understand that. But when you think about, if I'm going to take this forward, I have to think of, what's the downside safety? I can't be doing something that's going to be injurious to the person.
Of course.
So now it escapes me now where you wanted to take that.
When to say no. When to say that the surgery is not what you need at all.
Oh, yeah. Okay. You have to understand that my office was in remodeled student housing across from an 80-acre cornfield in the middle of Michigan.
Okay. And this is approximately when this happened? Is this 90s?
No, it would have been, it would have been in the 80s.
Okay.
Early 80s. And doctors were coming from around the world to watch me do surgery, and they would look for my office, and they would get in front of what the address was, and they were pretty sure that wasn't it, so then they'd drive all around town looking for a white ivory tower building. But mine were just remodeled student housing. And I made them nice, but they were pretty modest.
Okay.
But then the case that I like, my most famous surgical case is a non-surgical case. Okay?
I love this story, yes.
So at that time, because I was one of the first ones doing arthroscopy, famous sports people came to me from around the country because they knew they could have this operation without cutting the joint open. So I got a phone call from a agent in Boston who told me he had a patient who had a loose chip in his elbow, and they had been to 5 surgeons in Boston and New York, and all of them said that they would have to cut this elbow open to take out the chip. And they said that these surgeons heard there was a young doctor in Michigan that might be able to do this without cutting it open, which was me. So I got the phone call, and I said, fine, I'll be glad to meet with him. And the patient's name was Larry Bird. I know he doesn't care that I use the name because he gets a kick out of this story as much as I do. So I made it on a day because I didn't know what the case was, I made it on a day when I didn't have office hours. I could specifically only see him. And so he came in, and what had happened was that he had bumped his elbow in the finals of the basketball season in the spring, and his elbow was still swollen. They took an x-ray of his elbow, and they saw what was a chip in the elbow. And so he came to see me to have the chip removed from the elbow. And I saw the x-ray of his elbow, and I said, well, I actually think from medical school I can remember that there is extra little ossicles. The same way that the kneecap is a extra bone around the knee, there are little tiny ones that can be around the elbow that are normal. So I took an x-ray of his other elbow, and it looked exactly the same. So the chip was not actually a chip in the elbow, it was a congenital anomaly. And I sent him home. So my most famous surgical case is one that didn't require surgery. And because I know Jim Boylan, who's an assistant coach now at Indianapolis, who knows Larry Bird well, I said that Larry remembers that so well and got the biggest kick out of the story because they went to the country doctor across from the 80-acre cornfields to learn that he didn't need surgery.
It scares me that the others said go do surgery. Right? I mean, is that the takeaway also? Is it?
Yeah, that's what was kind of, I wondered if they hadn't been to medical school. No, I'm just joking, because that's where I learned about, there's a textbook written totally about the little extra ossicles around our joints. And I don't know, but here's the other problem too. Remember that, to think of it this way, these men were really much more famous than me, and they're famous because they do open operations.
Yeah.
So if I have a hammer, everything's got to look like a nail.
That's exactly what I had in my mind. If all I have is a hammer, then everything looks like a nail.
Yeah.
Yeah.
And so I'm not faulting them because I must be subject to the same error of thinking, or vulnerable to it. And so they send to me, Larry Bird's very famous. You got a chip in your elbow. I do surgery. We cut it open.
And I could see, again, if I was in their position, I could see the allure, the wow, I get to operate on this very famous individual.
Oh, sure.
I can understand that pull, even if it's subconscious, right? If it's
No, it's conscious.
it's conscious.
I know them. I gave a lecture at the American Sports Medicine meeting several years ago about who's influencing whom, and it was had to do with is the famous doctor is he being influenced by the patient that he's seen, because many of these sports medicine doctors have the pictures all over the room of all the people they've taken care of.
Yeah,
and many of them have publicists that put it in all the newspapers who they're operating on. I admitted all my famous patients under anonymous names.
I love that. Wow, I love that.
Yeah.
There was a word, and you just told it to me an hour ago, and of course it slipped my mind, but something I have in my mind often is, always do the best in every engagement, irrespective of, let's say, the interpersonal relationship with the client and yourself, or the patient and yourself, because you just never know what's going to come from it. Never know what's going to come from it. I have many examples in my professional career where, let's say, referrals would come from places that I wouldn't expect, right?
Mm-hmm.
And you have a saying, and you told me this, which was, and forgive me, I'm going to ask you to repeat it. I'm going toward the story of what happened to you when you gave the lecture and the parking ticket here.
Oh, okay.
Remind me that word, please, that you say. This is, the silent killer.
It's the silent killer. We have to be so aware of silent killers. Even today, I'm aware of silent killers. I don't know what I've said, how I said it, maybe well-intentioned. I don't know how it was heard. I don't know where the other person was coming from. But there are a lot of things that could be happening in my life that I've learned could be a silent killer, and this is how I learned it. That's what you were
That's exactly where I'm going to. Yeah. Yes, I'm very interested in this topic because, and again, I'm going to summarize in my own way, and please correct me if I'm mistaken, but we're living life. We're exchanging with countless people all the time, and you're saying you're aware of the fact that something that you say in a particular way may not be understood that way.
Sure.
And I think that the point of that is do your best in every engagement. Try to seek clarity with people, especially those of which you have less experience, so that there's less room for errors. Is that fair?
Well, that's true, but I can't be immobilized by trying to be so rigid that I'm perfect in everything that I do. I'm just going to have to be myself and be honest. But I still could have caused something that was a silent killer unintentionally.
Yeah.
I mean, I know the intentional ones.
Yeah, of course.
but the unintentional ones. So I wasn't aware of that until I was asked by Michigan State Sports Radio, would I come and do a 12 o'clock interview with them? And I said, gee, it's really hard. I finished surgery. I got to be in my office at 1 o'clock. Okay, I'll do it. So I went, and there was no parking place, and I kind of parked up on the edge of the curb and whatever so I could make it on time. I went in and I did the show for them and answered all their questions because I was seeing famous sports people. That was happy for them.
Yeah.
I came back out. I got a ticket. So I went back in and I said, oh, can you do something about this? No, we can't. I went, oh, I just did something for you, just for free.
Yeah.
You can't do it? No, can't do it. So the next day or two, I went to the police station and told them how I had serviced Michigan State and what had happened, and I got the ticket. I said, is there something you could take care of that? And they said, no, we can't take care of that. And so I went to myself. I didn't tell them. I said, this is a silent killer. At that time, I was the 17th highest personal donor to Michigan State. I've never given another penny. They don't know it. For $50, costs them a lot of money.
Wow.
And so I said to myself, you know what? I might be doing the same thing. I might be doing silent killers, actions that I've taken, things that I've said. And so I want to be alert. I'm not going to be immobilized by it, but I want to be alert. Are there any silent killers in my life right now? So I actually asked God if there's any silent killers, because he knows more than I know about my silent killers, to bring them to my attention. And also, I don't want to go forward and do a silent killer either. So I want to do the best by everybody that I can.
For a $50 ticket, see, it also, it's you would think that because of your history of donations, somebody would have recognized that it stopped or whatever had happened, right? And this happened a long time ago.
Yeah, right.
No follow-up, no nothing. That's another silent killer, not to know when to follow up, not paying attention, right? Not paying attention.
Well, big organizations like universities and governments, no one knows what's going on. They just ask for more money to do their job.
I see.
They don't look at efficiency or whether what the outcome is. We just get some more money to keep going.
Yeah.
That's it.
I do try to be very aware of the manner in which I operate, and no pun intended.
Yeah.
I do my very best. Sometimes hundreds of emails a day, many competing needs from different clients of mine, ranging from emergent situation, critical issue, to change something on my website. Less important, but important to the client nonetheless.
Absolutely.
Right. And it's important for me. I'll tell you something that I think that I've figured out along the way. A less seasoned individual in any capacity makes an offer to a client, whatever that number is. They start working. Let's say it's an ongoing engagement on a monthly basis. Client then starts to ask for other things, not part of the original engagement. It's referred to in my industry as scope creep. I don't know if that's across a lot of things, but happens a lot.
Sure.
And I think that what one must do, and is very important, is to understand when it's appropriate to say, I'd love to do this for you, and I have to charge X amount more in order to facilitate this for you. Not to think, oh, well, I want to keep the engagement that I currently have going on. I don't want to lose it. So therefore, I'm just going to give away a little bit more and a little bit more and a little bit more, a little bit more, until there is just, where you began and where you ended is two different complete places. It breeds also resentment, probably from both parties. Party A, the vendor, let's say, in the sense that, oh, well, they're taking advantage of me. And from the other perspective, it's, well, he used to be so responsive. Why doesn't he respond to me anymore? Right. And now when I start new relationships with my clients, I'm much better at, let's say, setting expectations, boundaries maybe. But what's I think most important is that I am not in this alone. I have a team. There's 9 of us. It's not just Alex sitting behind a computer. And oftentimes, if you don't follow the process in which I have established to gain support, the timelines will worsen. And I love the idea now of Alex is responsible for a set list of things associated with whatever agreement we have. I have some set pricing for things. I love that kind of model. And when you ask me things that are outside of the scope of those list of deliverables, I have a service level agreement. Here's how I deal with those particular requests. Here's an exact link to where you can read about it. And I'm going to attend to your request immediately and give you the same care no matter what. Not I'm going to not hear your request for 72 hours and then slowly finally get to it. Right? You with me on this? Yeah. I think that's been very helpful to me. And if I could give any advice to somebody that has a similar issue or something like this in their own professional career, it's be clear on your offer and don't be scared to say, hey, I'd love to do this for you, but you have to understand I'm running a business here. I have costs associated with the fulfillment of all of these things. And that's helped me. That's helped me a lot. It's helped me a lot.
I guess I would anticipate by saying it isn't uncommon, a new client. It's not uncommon in my experience that discussions will come up that are outside of the scope of our agreement.
Yeah.
So that's as important as our agreement.
Yes, it is. How do we deal with those things that are not part of it?
Yeah.
And
maybe you didn't anticipate it. Maybe I didn't anticipate it.
Yeah.
But it is outside of the scope of what we're understanding now. So here's how we would deal with that.
And I think one of the most important points is the communication. It's, again, what might seem like a relatively minor request to me, as I mentioned, to change this, change that, to the client is very important to them. And I like to tell my clients, listen, you do as much as you want on your own websites, but don't turn into a webmaster, right? That's not what you should focus on. Let us deal with the stuff that you don't want or know how to deal with, and you go run your business, right? Let me be that. Let me give you that kind of support that's needed so that you don't have to be a webmaster, et cetera, et cetera. There's a number of chief complaints I hear from every single potential client, right? Namely, I can't get support. It takes forever to get support. My website's slow. My website's stodgy. I have no plan. I have no direction, right? Those are like the major issues everybody has. And I don't want to repeat those. I really don't want to repeat those. So I thought to get your feedback. I like that. Say it's not uncommon for these things to occur in a relationship, and I want you to be aware. Here is how I deal with those along the way. Essentially, correct?
Mm-hmm.
Yeah, I love it.
Yeah, I think you could tell them that this is not uncommon to happen.
Yeah,
here's the different things that I know from my past experience. You may also know from yours. So here's the outline on the scope of our agreement. But if these things occur, then here's how those are also handled.
Yeah.
That's again the anticipation of the expectation.
Mm-hmm.
Well, I thought you were going to do all this. Well, no, that isn't what we agreed on.
Sure.
And then there are people who know darn well that you didn't agree on it and try to convince you that you did.
Yes.
Thank you very much. I think we're done.
Those are the engagements that I wish the rejection had been
earlier. Yes, right. But that's why we're now back to the thing. Don't try to force yourself into a rejection to get it.
Yeah.
I don't want it.
Yeah.
I know it can be more problems.
And not just can, but a very high likelihood of
maybe I said this before, but I used to tell people, I don't think I can do what you're hoping for.
I love that. I don't think I can do what you're hoping for.
Yeah. And they're okay with that.
Yeah.
They go, well, how come? I said, I just know from experience from what you've discussed and what you're asking for, I know the limitations of what I'm able to do. I don't think I can do what you're hoping for.
Yeah.
Therefore, I think we shouldn't go forward. You should find someone who can then do what you're hoping for, which is fine with me.
Look, I've said this so many times, but not in our conversation. I think you'll laugh, but one of my favorite lines is that the web design digital marketing space is an unlicensed, unregulated Wild West. Wild West.
Mm-hmm.
It's no barrier to entry. In your profession, your line of work, extreme barrier to entry. Medical school, this, that, unbelievable barrier to entry.
Absolutely.
And still there's issues, right?
Yeah.
So imagine in my industry where there is zero licensing, zero anything. The problem that, the first thing that popped into my mind when you were saying, hey, I don't think I can do what you're hoping for is, unfortunately, there is another vendor out there that high likelihood doesn't have the skill set in order to achieve it, but they darn well will sell it to you.
That's okay with me.
Yeah? Well, it's not your issue, right? It's not your issue. You've done your best to educate the customer and tell them this is how I see this thing going, and I don't think you're going to be able to resolve it well. I just think from an education perspective, an educated client is a very good one. I think you would agree that an educated patient is probably better than an uneducated patient in the sense of what you're going to do for them.
Well, sometimes the educated patients, they want to tell you how to even do the operation. So,
which,
it doesn't make sense.
Doesn't make sense.
Yeah. Here's another word that I've learned to use. When I'm talking to somebody, I'm seeking whether we're going to have a harmony of interest. I really like that phrase, the harmony of interest, because it's a nice way of saying, I think we ought to explore whether we have a harmony of interest here, of understanding, so to speak. And then that kind of settles it down, and then I can get to the place where I say, I don't think there is one here.
I love that. Know who you are, be who you are. Don't push it. If the rejection is obvious, let it be.
Thank you.
Let it be. Your life will be.
Thank you note.
Yes, let it be. And I will admit that, again, look, I'm in a creative space, different in the sense from your profession that, like in yours, correct me if I'm wrong, but it's more black and white. I've performed the surgery, I've done it well, it's healing, all the things that needed to happen, right? In mine, it's, do we like this color? Do we like this style? Is this appropriate? Is this not appropriate? It's more on the creative side. Not to say there isn't creativity in what you do. Of course there is, but you see my point. It's that.
Well, I think here's the thing. I taught on the PGA Tour, and I used to tell the players, it's easier. Surgery's easier than golf, and they would think, oh no, surgery must be hard. No, I said, no. Let me tell you, in surgery, I control all the environment.
Yeah.
In golf, you have no control over the environment.
True.
You don't know whether the wind's going to blow or not blow. Is it going to be a gust? Is it going to bounce? Is it not going to bounce? Is it going to stick in the mud? Is it going to roll? I said, you've got so many variables you don't control. In surgery, I can control all the variables. It's easier from that standpoint.
Wow. Well, it's easier also because you have thousands of hours and expertise in, in honing it. But I understand.
What I'm saying is that when you're telling me you've got so many variables of colors and shapes or whatever, that I think you have to get to the places in the service that we deliver, here's the way we control these things.
Yes.
And so
I don't have the answers to all things, nor am I the best designer that ever lived. I don't think that's not my offer. Right? My offer is that I've amassed a fantastic team, and we've done, I don't want to exaggerate, but maybe I've done 1,000 projects in my career. I have some experience. and I'd say more so than the business owner looking to redesign or reimagine their site. Why hire me if you can do it yourself? I often will say to my clients, the best engagements are ones in which you allow me the freedom to take this project where I feel it needs to go. I'm not saying that I'm a dictator and you must agree to everything, but let me run with it. I found that those are the best engagements, the ones which I am allowed the freedom to envision what needs to happen and execute it.
I can relate to this in a thing I'm doing right now.
Okay.
I'm working on a lozenge for a treatment of the bacteria in people's mouth. So I didn't know a thing about lozenges, but I knew how I wanted to do mine. I wanted to have this ingredient and that ingredient, and that's it, and nothing more. I didn't know that most lozenges have about 8 or 10 ingredients.
Oh.
So I'm working with a man who I like, and I just was with him yesterday. And he said, "You're putting an awful lot of limitations on me." And I said, "You know what? I think I have to give you more freedom. I've told you what I would like to do. Let's get to that goal, but we got to do it with your way, not my way, because I don't know a thing about what you're doing. So your client coming to you wants to tell you how to do it his way.
Yeah.
You're asking, you got to give me a little liberty to be able to do what you want."
Correct.
And so that's where I learned that yesterday in my lozenge business.
I love that. And look, the inverse is you hire me and then don't allow me to, let's say, spread my wings and use the team and do what I know needs to happen. And it ends up, frankly, those are the worst engagements. Not worst is a strong word, but those are the engagements that take the longest, and I don't think the outcome is as good as it could have been. Again, I'm not saying we're the best that ever was, but I care about the outcome. I want harmony in my relationships.
Yeah.
And there are many services out there that will say, pay us $699 a month and you can have an unlimited design and you can change anything you want. Those are order takers. Hire an order taker if that's the direction you want to go. Otherwise, allow us to, I said this before, you've hired us because you have the faith in us in order to produce the right product.
Well, I hired you to get what I want.
Yes.
And so we have to work together to that extent.
Yes.
But I can't be dictating to you how to do it because I don't know your end of it.
Sure.
But I do know what I want.
Yeah.
So I then give over to you. I told you what I want. I'm now like I did with the lozenge guy.
Yeah.
I said, okay, I never made a lozenge. I've got to leave it up to you to do it.
Yeah.
But here's what I want.
Yeah.
He said, well, thank you. Now I think I can do it.
I love it. Yeah. I think it's again about, I must respect your wishes, please. Of course. Right. There's a pride involved in the work that I do. It's very important for me to feel energetic and enthusiastic about the work that I'm doing. Otherwise, inevitably, it won't be as good, right? It won't be as good. I need to bring energy and, energy, and I need to push the project forward to a point where we're going to get it done in the timeline of which I've promised, right?
Sure.
And again, the best engagements for me is, you've seen the portfolio, you check the box that Alex and the team at Sage can do design work, you hire me, I will listen. It's one of my skill sets, I promise, is to listen to my clients. I mean that, right?
Yeah, right.
I'm not just blindly going forward and not listening. That's not the case. But yeah, give me the ability to do what I need to do.
There was a topic that we hadn't hit on that we might have hit on before, and that was, what would the value of a really good website be to me as an entrepreneur? And I think I brought to your attention that I've made a number of my websites. I'm not even selling anything, but they look like I'm selling something. But I want them to be the best that I can, because when I go to meet with somebody, or if I'm on a Zoom meeting, I say, oh, by the way, are you in front of a computer? Yes. Oh, well, I can best explain this to you if you would just pull up this website, strayawaydoa.com. And they bring it up, and I say, and there's a 14-second video there you can look at. That's good. Now, what happened to me recently with people that are really in the industry, in the health industry, on the internet, they saw the website that you had done for me, and that really gave me a lot of credibility, because they said, wow, you've really got a good website. So the website was really saying what kind of work Lanny does. And he gets it done really well, which you did on my website on the drlanny.com that has the arthritis pill on it. And
the health, yes.
They continue to be interested in me. Why? Because that's their business of selling via that avenue.
They know online, they know e-commerce, right? So they see a great site and they said, wow, okay,
Yeah.
you've invested time, energy, money, resources into it.
Yeah.
Look, I often say, like, the website is important. It's not everything, in the sense of, you are what's important in this. You are. But, like, nobody would ever turn down a great website for a not great website. And in the inverse of that is, everybody that doesn't have a great website, it's not a good representation of the brand.
Mm-hmm.
And there stands to be improved significantly. So I love the fact that you were on recently conversations with some groups that, correct me, selling millions of dollars of products.
Absolutely.
Huge numbers.
Huge.
And if my memory serves correctly, they had mentioned to you on several occasions on that call, wow, it's a great site.
Yes,
right?
correct.
Which makes me very happy. And yes, it does help with credibility, and even more so, I would say, with groups that don't have the, history of Dr. Lanny, right? With a startup, maybe it's not a famous individual or world-renowned individual. I think even more it's then important, right, to say. And there's something to be said about a company with a great website that's invested in it. They care about how they are presenting themselves. I feel like that care is also then moved over to the care of their service, or the care of the quality of the product, the care of the customer experience, right? Versus, is this just the cheapest thing that I possibly could have slapped together and presented? Is it good enough? You wouldn't believe how many times people call me. There's a couple of things that happen that I know right away, this isn't my client, right?
Yeah.
How much does it cost? First question.
Mm-hmm.
So how would I know how much it costs? We talked for 20 seconds. I don't know. Let's have a normal conversation. Don't look at me as a commodity that just because somebody else offers you a price for $2,000 less, somehow you're getting better value there. That's nonsense. It's not true. I have IP, intellectual property, that is a decade of experience plus myself, 100 years of collective experience, the team of Sage, right?
Sure.
There's tremendous value in that. And I believe that what really comes down to is that, when you present something, in such a way as a beautiful website, it shows you care about all these things. In my business now, I'm very interested in the customer experience more than ever before. We've grown, we have lots of things happening. Am I providing the best possible service that I can, right? Are there silent killers in my process?
Yeah, sure.
Right? And if there are silent killers in my process, I need to fix them, because that's the most important thing, because there's only so much of Alex that can be present in all of these engagements. Mm-hmm. I want to make sure that I'm not losing before I've even got started,
okay.
Right?
Okay. Two things that occurred to me. One is that I had a way that I called History Maker, in which the patient would come and sit in front of a computer. My face would come on the computer, and I'd ask them a lot of questions. And therefore, I took the medical history before I ever saw them. And when all the input that they made off the touch screen was put into the computer, and when they were done, they finished, they were done, and it printed out. It stored all their data about their medical history, and they brought into me their medical history.
Yeah.
And what the people said is, I feel like I know you.
I love that.
Which I think is what happens with my website. I think because if a person's on there speaking, I feel like I know you. And so I think that's a very powerful first impression.
Certainly.
And so I think if people would see their website as people that hit it, that is your first impression. And so you want to have them be engaged with you and feel like they know you, mm-hmm. especially in the doctor-patient relationship.
Oh, yes.
I don't know this doctor, and he's going to operate on my knee, and,
and look, we could talk endlessly about, look, you know better than anyone. Today, you go to a physician, it's in and out, no relationship. I took my mother to a pain management doctor not long ago. She's suffering in a particular way. The gentleman walked in. He didn't even make eye contact with us, not once. He was staring at the paper, started talking, made some notes, did it, and out. Yeah. No relationship. Mm-hmm. Correct me if I'm wrong. You mentioned this in the past. I don't remember if we talked about it on camera. What you talked about, you developed custom. This is decades ago, correct? This wasn't yesterday.
Oh, no.
And you spent, correct me if I'm wrong, a relative fortune in order to create this system when such a thing it wasn't like today. You can go pay a subscription and there's unbelievable platforms and everything is done for you. Mm-hmm. You had to ideate this, and you invested hard-earned money and time to develop it in order to, correct me if I'm wrong, one of the reasons is to improve the patient experience. Yeah. And I love the I feel like I know you, because you know what? I get that comment all the time. I start conversations. I get inquiries on my website on a daily basis.
Okay.
I have marketing efforts that are a few different routes, primarily Google ads, Facebook, Instagram ads, Meta. People see content of mine. It started right here in this room.
Yes.
Something resonates. I hear it all the time. Your content resonated with me. I said, fantastic. That's what it's meant to do. It's meant to resonate with my ideal client, the person that I know I can help, because I can't help everybody.
Okay.
And I get that all the time. Oh, you're the guy from social media. I feel like I know you. I feel like you're already I go into conversations with people where it's obvious that I'm already the vendor of choice, or at least in the top few that they're speaking with, versus, well, who the heck are you and how can you help me and why should I even, So it's been very helpful. And I what I'm saying is it's resonating with me. Yes, the website is I always say, representation of who you are today and a representation of who you think you're going to be in the not too distant future.
One of the things that occurs to me, by the way, you're also, by the way, qualifying your customer by this method.
I am.
You're finding who would like me.
Yeah.
Or what my service is. Now, we'd have to be a little bit careful that you're not qualifying a customer that it has great expectations too.
Sure.
So I think I want to qualify the customer that I know that I can do something for.
Yes.
Now, that may be that you get a large group that comes in and then you qualify the customer thereafter. But in a sense, I think that the website, it occurred to me just while we were talking, is qualifying my customer, which is so critical in any kind of business.
I went from, look, I've learned a lot. I have the marketing engine, so to speak, well tuned. But that didn't happen overnight. I often joke I'm bald in my later 30s. One of the reasons is from the amount of money I lost in marketing efforts over my career.
How you're learning, right?
It's a learning experience. Lots of rejections, right? No shortage. But what has worked for? Look, I'm not saying this will work for everybody, but what has worked for me: clear, transparent pricing that is available on my website easily. Statements around this is who I am. Are we a good fit? Before you ever talk to me.
Sure.
Before you ever talk to me. Here's my portfolio. Here's what you can expect. If you like what you see here, this is what you can expect from me.
Mm-hmm.
And just being rather direct and saying, this is the things in which I excel and I am not A, B, C, D, E. And I actually have some video content that I've created that has worked best for me in essentially saying, if this is who you are, then I am the right person for you. Mm-hmm. And I would recommend any business person that's doing any kind of spend online to take the owner first approach, take that kind of putting yourself forward and saying, hey, if this is the person that you are, this is what your expectations are. If you're in the top few percent that demand a result quickly, then, let's talk.
Yeah. I had a thought came to my mind and it escaped me, so I apologize.
No problem at all.
Had the thought, started listening to you, and then the thought escaped me. So
no worries.
If it comes back, I'll bring it up.
There's endless subjects in which I believe you and I could talk. You've been very, very good to me with the amount of time you've given me. One of the highlights of my professional career is to spend time with you. I mean that, and I thank you.
Well, the rate is really good.
What an inspiration. What an inspiration. I pray to God that I will have a close personal relationship with you for years to come. And I hope that you will join me again and we will continue the interesting conversations. The value of your perspective is immense, immense. I cannot thank you enough for joining me. And thank you.
Okay. My pleasure, Alex.
Yeah.